Okay, this is case 661. My case, the patient came in, it was tooth number 3. They were in extreme pain, and we took a PA, and then we took a bite wing, and you can see there's a smaller, not a extremely deep composite. I was suspecting a fracture, and I could actually see a crack line mesial to distal. So I warned the patient. Patient wanted me to give it a try to get in there and see if I could save the tooth. Take a cone beam on almost all of the cases we treat. This is the axial view, and then you can see the sagittal view and getting an estimated working length. Didn't really see clear periapical radiolucencies on the sagittal or the coronal view here, but I did get a working length. Extremely sensitive to percussion and bite. Very, very slight response to cold. So I assume that it was necrotic. Maybe some nerve fibers are still alive, but I did see the fracture and did see thickened PDL. I went ahead and I shaped to a Wave 1 Gold primary. So I did the slider, the ProTaper Gold S1, and then the primary. I call it the slider gold technique. And then I used the laser as my irrigation protocol. So you can read through that, take your time. I did a lot of 30, a lot of sweeps, irrigation, 30-second irrigation cycles. I ended up doing about 11 cycles of the laser of sweeps, and then SSP modes, like a dial down mode at the very end after shape. And I use that. So I wanted to see how well this would do at a 25 tip size, how well this would do cleaning out all the tissue and any bacteria. So I'm looking forward to seeing Gary's results.
So let's look at the mesiobuccal root first. This is the axial view, so you can see both canals have been instrumented. But when we split it sagittally, you have this soft tissue in the isthmus area. So let's look at that first. It looked like at least partially vital. And we're going to look at the edge near the more terminal end of the root, that white material. And then when it's dehydrated, you can see it's quite a bit of tissue. And we'll just look at the edge of that to see if we can determine if there's any microorganisms or any biofilm there. So this is the area that we're looking at. And as we go into this area, it looks like, vascular tissue. But what you can't tell is, has the laser altered any of the morphotypes, bacterial morphotypes? We see some echonocytes there, but we get a very confusing picture. I can't tell whether these are altered bacterial morphotypes or whether it's just some of the predentin that's been churned up by the laser. So there's a lot of uncertainty here. There's obviously chunks of predentin present, but also some things that could be bacteria, but they're misshapen. So it's very difficult to tell. I really don't know. If you go up into the another area further away from the terminus and look at the canal wall area, where there's been instrumentation, and it looks like a fairly clean dentinal wall with your typical laser appearance of having gone through a tornado or a hurricane. So let's look at the distal buccal root. I'm going to go down in the terminus area and look where it appears as though in the instrumentation the soft tissue has been pushed up against the lateral axial wall, and the rest of the canal is very, very clean. So I don't know if this is a function of the Wave 1 instrumentation, that this soft tissue gets just packed up against the lateral wall, but there's quite a bit of tissue here, and the rest of the canal looks to be very, very clean. But I don't think there's been a lot of demineralization that's gone on here. So I urge you to go through the stitched sections and the collages. There you can see just kind of classic predentin that's been jumbled up by the laser. And whether there's bacterial morphotypes there, I really can't say, because I don't know how the laser affects the morphotype. If you look at area 8A, which is basically the canal wall, and you go in, you do see some dentinal tubules, but not a lot of demineralization has taken place, even though Reed did apparently use EDTA in this case. Even some of the red blood cells look like they've been deformed by the laser. And here you can see that chunks of predentin look like they've been deformed as well. So we're going to have to look at a lot more laser cases. There you can see kind of a deformed red blood cell. And in looking at the mineralization front, there isn't a lot of demineralization. We're right down on the mineralized part of the predentin. And it doesn't look very demineralized to me. When you go into an area further coronal, I'm using TDO to show these instead of the web page. In area 9, we're looking at an area that looks like it was very, very clean. And so further coronally, you do have some more evidence of demineralization because you have some dentinal tubules clearly showing. And as you go through these, you get a pretty good sense for how clean the canal is, how demineralized it is. There you can see some patent dentinal tubules, but it looks like the intertubular dentin still has not been demineralized. So it's very difficult to really figure out what the Tritons is doing here and what the EDTA is doing. There you can see some undemineralized predentin. And then when you take a very close look at the dentinal tubule, you can tell the intertubular dentin still has been mineralized. So I covered the palatal root pretty much in the preliminary examination, so I'm not going to do that, but that's what we found.